Welcome to the How to Use a Gel-Free Probe Cover video. This step-by-step video explains how to use the Envision gel-free probe cover during a peripheral intravenous catheter placement. The video will highlight how the procedure can be done without the headache and hassle of gel while maintaining high-quality ultrasound images. The first step is to gather your supplies before you begin the procedure. Ensure you have all the necessary supplies according to your policy and procedure. Some facilities will have ultrasound-guided PIVC insertion kits with all the necessary items. A kit will help reduce the time needed to grab different supplies from individual drawers or bins. Having the supplies in one kit will also help standardize the procedure and support compliance so everyone approaches the procedure the same way. Place the patient's arm on a towel for comfort and cleanliness. Then apply saline to the area you want to scan. Saline is not as thick as gel, so the clinician may want to increase the gain slightly. Next, using the probe with the saline medium, scan the patient's arm to find a suitable vein. If the patient's skin is dry or veins are poor, the inserter may need to hydrate the patient's skin more than once with additional saline. Once the vein is located, clean the site thoroughly with an antiseptic solution per the manufacturer's instructions. Allow the area to air dry. The inserter must know the key site and key parts to maintain sterility. The key site will be the skin over the vein that is properly disinfected, and the key parts are sterilized parts such as the catheter, the syringe tip, the extension set luer connections, the needleless connector septum, as well as the area of the probe face once the Envision probe cover has been applied. Start by disinfecting your hands and donning gloves. Open the Envision probe cover, being careful not to compromise asepsis. Peel the liner away from the cover to expose the adhesive pad. Place it onto the face of the probe and pull the cover over the probe, ensuring the key part of the cover that contacts the patient's skin is not touched. Secure the cover with the enclosed bands. Sometimes the probe cover may need to be adjusted. If your ultrasound image is poor, the cover may have wrinkles or air between it and the probe face. Carefully release the cover and pull it tightly over the probe face while maintaining asepsis. Some clinicians prefer the ultrasound across the bed, and some prefer the machine on the same side. Either way is acceptable. Prevention of probe face contamination is key, and it must be protected in either. Your facility policy may require the procedure to be performed using sterile gloves from a critical aseptic field. When using sterile gloves, the critical aseptic field is a key part, and the probe cover has an expanded area to protect. When placing the probe cover on the probe, the clinician can touch the entire cover with sterile gloves. Let us look at how to apply the Envision probe cover with sterile gloves without contamination. First, peel the liner to expose the adhesive pad on the probe cover. Apply it to the probe face. Deploy the cover. If wrinkles are present, the clinician can smooth the cover with their fingers or pull it tight. Ensure the Envision cover and the skin are fully hydrated before use. The cover comes with a convenient saline hydrating pad. The pad is highly saturated, so the clinician can drip the saline onto the site and probe. One helpful hint to hydrating the site is to gently drag the saline pad over the prepped insertion site with light pressure. Further hydration can be performed by dripping additional sterile saline from a syringe. Rehydration can be repeated as necessary. Stabilize the probe with a relaxed hand and insert the PIVC using ultrasound guidance. Always know the location of your needle tip. Once the bevel is clearly inside the vessel, thread the catheter into the vein. After the successful insertion, assess for patency by aspirating blood and ensure the device flushes easily. Apply skin protectant. Secure the catheter with a transparent dressing and tape the extension set appropriately. Finally, discard the used supplies, perform hand hygiene, and document the procedure. Using a gel-free probe cover simplifies ultrasound-guided peripheral IV catheter insertion by maintaining sterility, reducing cleanup time, promoting dressing adherence, and enhancing patient comfort. Thank you for watching, and we hope this demonstration has been helpful.